In this video we are going to talk about the main complications of penile enlargement surgery. It's a surgery where complications are not common if it's done properly, because it's a surgery that the real part of the surgery, I mean dividing the suspensory ligament, the skin flap, the muscles, this part only lasts for us between 20-25 minutes. Now, we were talking 2 years ago or 3 or 4, I could talk about 4-5 hours because we were at the beginning. But now it's the same as with extensive sex surgery. When I started to do vaginoplasty, I need a whole day to do it, and now I can do 2 in one morning. So every time you increase your performance and increase your cases, it's easier. So as it's a short surgery, it can even be done with local anesthesia. We don't really usually do it only with local anesthesia because you feel more comfortable if we use a bit of sedation. But the thing is that it's not an easy surgery, but the probability of having problems is very low. The main ones are bleeding. I mean, we have really big vessels in the penis. It's a super small area. The scar is very little, and we are going to be in the middle of an area with bone and rounded with vessels. So sometimes we have some bleeding. The good thing in one sense is that if there's some bleeding, we are going to see it in the surgery room or during the first 12-14 hours after surgery. But once you get recovered, you start to walk. That usually is about 3-4 hours after surgery. We are going to check if there's something bad in this sense. The other things are the common with any surgery, there are infection, very uncommon in the surgery, and that you can have some swellings and hematoma. This part is the most common one in the week after the surgery. Some patients even arrive to have some hematoma in their knees. Why? Because it gets with the gravity down, but it's very common and has nothing to do with how the surgery is done, because it's something that belongs to your body. So these 3 things are the common ones, and the special ones are the sensibility, direction, and all that stuff. We have never seen in our cases any situation in which has been damage to the nerve or in which the patient has problem with erection. This doesn't mean that cannot happen, because it's medicine, we cannot assure anything. But the most common is that we don't have any kind of these problems. In other sense, you have to remember always to be patient, wait 6 months after surgery to see the results, because once the surgery is done and everything is perfect in medical sense, the main problem of the surgery is that you are so anxious and are waiting that long the results that won't allow your penis to recover, to start to have bigger vessels, the diameter to get increased. So you have just to get relaxed and enjoy the results.